In today's video our topic is tooth numbering system. Hello, salam, I am Dr. Usman Ali Khan. Tooth numbering is a notation used by dentists to denote and specify information linked with a particular tooth. Using a tooth numbering system allows for easy identification, communication, and dental record maintenance in an easy and a precise manner. Tooth numbering serves various purposes like helping to identify and classify the condition associated with the concerned tooth both clinically and radiographically. This allows easy communication among the dental professionals to assess and treat dental disease. Globally, there are several different tooth numbering systems. Some commonly used systems are the Sigmondi-Palmer system, Universal Numbering System, and the FDI System Numbering System. Among these systems, Sigmondi-Palmer system is the oldest and by far the most widely used. Sigmondi-Palmer system was introduced in 1861 and is popularly called Palmer's notation among dental professionals. Some other systems are the Victor-Haderup system, Wolfel system, and MICAP system. Even though most tooth numbering systems focus on classifying permanent teeth, notations for deciduous milk teeth are also available under each system. What are dental quadrants? Understanding dental quadrants is important for understanding tooth numbering systems. Dentists divide the whole dentition into 4 quadrants or sections. The upper arch has 2 sections, upper right and upper left sections, which are named first and second quadrants, respectively. Similarly, the lower jaw has the third and fourth quadrants. Dental charts are prepared from the perspective of the dentist, wherein the right side is shown on the left side of the chart and vice versa. Dental quadrants also allow a quick and easy understanding of the concerned tooth. All naming systems require an understanding of quadrants so that a specific tooth located in a particular quadrant acquires the designated name. What is the Universal Numbering System? A universal tooth numbering system was first proposed in the year 1882 by German dentist Julius Pareide. Under this naming system, primary and permanent teeth are named differently. This naming system is accepted and approved by the American Dental Association (ADA) and is the most commonly naming system used by dental professionals in America. One drawback of this naming system is that it fails to classify supernumerary, extra teeth. However, the main advantage of this system is that it follows a sequential pattern of naming teeth and can be easily understood in locating the concerned tooth. Owing to its easy understanding, ADA accepted this nomenclature in 1968. How are primary teeth are named under Universal Numbering System? While numbering the primary teeth under this system, the naming begins from the upper arch, both the quadrants, starting with the letter A and proceeding sequentially through J. It is important to note that while numbering the primary teeth, the tooth naming is assigned only in uppercase following from a till T. Naming permanent teeth under Universal Numbering System. Permanent teeth are also assigned numbers sequentially. The naming starts from the posterior-most region of the upper first quadrant and each tooth is numbered from 1 to 32 in a sequential pattern. The numbering starts from the third molar tooth where the upper right third molar is assigned the number 1. This naming system follows a sequential pattern and continues until the left third molar tooth, which is numbered as 16. The similar pattern follows in the lower dentition wherein the lower left third molar in. The third quadrant is assigned number 17. Sequential pattern ends with number 32 with lower right molar tooth.